My name is Shauna McGee from Kyoto News, and on behalf of the UN Correspondents Association, we'd like to thank our two speakers today with us. We have Dain. I have to look at your title, Chief Executive Officer of the Noncommunicable Diseases Alliance. And then we also have Mr. Adam Karpati, Senior Vice President of Public Health Programs at Vital Strategies, who will be talking to us about the upcoming high-level meeting on September 27th. And I'd like to turn it over to you. And after that, when we have questions, please introduce yourselves and we'll go around the room. Thank you.
Thank you very much. And thanks very much to the UNCA for the opportunity to be here today and talk about non-communicable diseases and the upcoming high-level meeting that will be taking place in New York in 2 weeks. So I'm Adam Karpati from Vital Strategies. We're a global public health organization based here in New York City. And I will be speaking a little bit about background on non-communicable diseases, what they are, what the problem is, the burden of the problem, what some of the solutions are to dealing with this important public health set of issues. And then Dain will talk a little bit about the upcoming meeting and about some of the global actions around NCD mobilization and action. So we work, Vital Strategies, the organization I work with, we work around the world on a variety of public health issues, including non-communicable diseases. We work in over 70 countries and with a lot of governments. And the perspective that I'll be speaking about largely today is one of the burden of non-communicable disease, especially in low and middle income countries. But really this is a global public health issue, and one that and one that really touches people all over the world. I'd like to start by providing some background on why non-communicable diseases are such an important set of issues, and really what they are. So non-communicable diseases refers to a group of disorders, a group of conditions. They're called non-communicable because they're distinguished from infectious diseases. And frankly, infectious diseases, and as well as some other health conditions like maternal and child health, have largely been the focus of global public health action and government action, especially in low and middle income countries. Much less activity, much less attention has been paid to non-communicable diseases. And what are these non-communicable diseases? Heart disease, cancer, diabetes, chronic lung disease. This is the group of disorders that get put under this category of non-communicable diseases. Each one of these is poses a huge burden of suffering and death to millions and millions of people around the world. Importantly, these conditions have at their root what we in public health call risk factors, determinants, causes of these conditions. And the important thing about understanding the risk factors for non-communicable diseases is that it leads us towards public health action. It leads us towards prevention. And prevention, coupled with treatment, is the core of what we're trying to talk about today and what needs to be done. And so what are those risk factors? So if you think about what those NCDs, non-communicable diseases, are, heart disease, cancer, lung disease, diabetes, the risk factors are pretty clear and well defined. Tobacco use, nutrition, alcohol consumption, physical activity, air quality. So when we understand the conditions and we understand the risk factors, we can understand what to do about them. And one important thing to understand about non-communicable diseases, many people perceive these conditions and their risk factors to be issues of individual behavior. Right? A lot of those risk factors are about behaviors, smoking, drinking, etc. And incorrectly think that the solutions to NCDs, the solutions to reducing the incidence of these conditions, lies with the individual solely, lies with exhorting individuals or educating individuals to make better choices. Now there's some value in that. But much more important is to understand that individual behavior choices occur in a context. They occur in a social, an economic, the physical environment. All of those environmental or contextual issues, whether they are have to do with commercial activity, availability of products, prices of products, advertising, the conditions under which people live, these are important determinants of behavior and in turn of NCDs. And this implies when we know that the conditions under which people live are important determinants of risk, that's where government has to come in. That's why government has such a strong role and responsibility to create environments that are conducive to health, that are conducive to healthy behaviors. And that's really the message that I want to impart today, that dealing with the NCD problem requires dealing with the conditions under which people live, which requires government action. A few numbers. NCDs kill 40 million people globally every year. 2/3 of those deaths are cardiovascular disease and cancer. When we think about the leading global killers today, heart disease and cancer. 70% of deaths globally in all countries of the world are from NCDs. 3/4. NCDs have often been perceived as a wealthy country problem. But we know that most NCD deaths, 80% of NCD deaths, occur in low and middle income countries. This is a global epidemic. Another misperception is that non-communicable diseases are diseases of older people. While that is true, a substantial proportion, nearly 50% of NCD deaths are among younger people, ages 30 to 69. And in low and middle income countries, the burden is even higher. Even a higher percentage of non-communicable disease deaths in low and middle income countries are younger people. So it's a younger person's set of diseases, and it's a global issue. The burden of NCDs, the mortality burden, and of course, for every death from a chronic condition, there's many years of suffering. We call it morbidity in epidemiology. The morbidity and the mortality impact is enormous around the world. But there's also great economic impacts as well. NCDs, these conditions help perpetuate cycles of poverty among vulnerable, low-income families. NCDs are a threat to economic development in countries. The economic losses that are attributed to NCDs amount to the trillions of dollars a year globally. They arise from healthcare costs, social care costs, lost income, lost productivity. And importantly, the interventions to deal with NCDs that I'll talk about in a moment are highly cost-effective. The WHO issued a report that they entitled Best Buys. And it was a very rigorous analysis of the economic benefits to countries, the return on investment for intervening, taking action on NCDs. And they found that for every dollar of investment in prevention and treatment yields $7 in savings and economic growth. So there's a public health imperative to act on NCDs, and there's an economic imperative. I'll run through a few of the risk factors because, again, it's important to understand the conditions, as I've talked about, cardiovascular disease and cancer primarily, and important to understand the risk factors to understand interventions. Tobacco use. Dealing with tobacco use is one of the most important things, not the most important thing, that countries need to do to control NCDs. Tobacco is a major risk factor for both heart disease and cancer, of course. There's about 7 million deaths a year attributable to smoking. About 1 billion people in the world smoke. And if we don't act, 1 billion people will die this century of tobacco use. Deaths from tobacco use are 100% preventable, right? Because tobacco use is a behavior, and that behavior is in turn driven by commercial activity, by industry actions, promotion, marketing, etc. Alcohol use, 3 million deaths a year. 2/3 of those deaths, those 3 million deaths attributable to alcohol consumption, to the harmful use of alcohol, 2/3 of them are NCDs. Alcohol is a leading cause of death and disability. A recent study in The Lancet from the Global Burden of Disease found that alcohol is the leading cause of death and disability among young people aged 15 to 49 in the world. The causes of suffering and of death related to alcohol relate to both cardiovascular disease, cancer, infectious diseases like tuberculosis, as well as injuries, road crashes, suicides, homicides, etc. Crosses from NCDs to many other causes as well. Many people do not perceive alcohol to be a public health problem, but it is a huge one. Air quality. Indoor and outdoor air quality and air pollution are important and major contributors to NCDs. The sources of air pollution, for example, for indoor air pollution, and again, poor air quality is attributable somewhere around 6 or 7 million deaths a year around the world. I mean, the magnitude of these mortality impacts is huge. So I'm going a little long. Indoor air quality, poor indoor air quality is often a function of using basically biofuels for heating and cooking. Wood, charcoal, and things like that, highly prevalent in low and middle income countries. And of course, because used in cooking and in heating homes, the burden is often borne by women and children for indoor air quality, indoor air pollution. I want to say a word also about mental illness. The UN Sustainable Development Goals for chronic diseases, for non-communicable diseases, is 3.4 in the SDG list, the Sustainable Development Goal list. Talks about those 4 conditions I mentioned: cardiovascular disease, cancer, diabetes, and lung disease. Also talks about mental illness. The burden of mental illnesses, depression, anxiety, schizophrenia, developmental delays and disabilities, dementia, the burden is huge. In any room of people, if I were to ask how many people in this room have in their family close to them someone who suffers from mental illness, I think the rate would be, I think you'd find that a lot of hands would be raised. It touches young, it touches old, and there is not nearly enough attention to dealing with mental illness, and I'll talk about what some of those actions should be. So I'm going to conclude my remarks with just a few words about solutions, about what needs to be done. I've talked about the burden, I've talked about the magnitude of the problem of non-communicable diseases, talked about what some of those risk factors are. The message I want to convey around interventions, around actions, is that we know what to do. The world knows what to do about NCDs. Yes, there's more science that needs to be done. We always need more science about optimizing our strategies and attacking the causes of morbidity and mortality. But by and large, there is strong science and strong evidence about what works to control NCDs. And it's a matter of political will to implement these known solutions. And the World Health Organization has very clear guidance for each risk factor, each issue, a concise set of recommendations and guidance for countries to adopt. For example, for tobacco. The most important thing countries can do for tobacco is to implement the WHO EMPOWER, is the acronym, EMPOWER, technical actions for tobacco control. The most important of which is taxation. Raising the price of tobacco is the most important thing a country can do to control NCDs. Despite this clear recommendation and clear evidence, only 10% of the world's population is covered by tobacco taxes sufficient to meet the WHO recommendations. A highly underused strategy, even though it is highly effective. Other strategies include marketing restrictions. Again, because so many of these behaviors and these risk factors are driven by industry behavior, regulation and restriction of marketing and advertising is important, an important intervention. Other interventions include warnings on packages, smoke-free laws to keep our air clean in public places, etc. Alcohol. Similar to tobacco, the most important strategies that WHO has identified for alcohol policy are taxation to raise the price, restrictions on marketing, and regulation of sales, age limits of sales, hours of sale, etc. These are proven strategies that save lives. Air quality. I talked about the burden of air pollution, especially indoor air pollution. Strategies for that are also clear. It's about making more people in low and middle income countries have access to clean fuels for heating and cooking. In particular, liquefied petroleum gas, electricity, of course, liquefied petroleum gas. Many countries have successfully shifted from biofuels to LPG, thereby making those home environments cleaner and saving lives. Cardiovascular disease, other interventions include, important interventions include trans fat elimination. WHO has just come out in the past couple of months with its first call for eliminating a risk factor for non-communicable diseases. Trans fats are synthetic fats that are added to foods that have toxicity and cause heart disease. And we could save hundreds of thousands and millions of lives over the long term by eliminating trans fats and switching to healthier cooking fats. And WHO has recently called for the elimination of trans fats from the global food supply. Sodium reduction. Major risk factor for hypertension is sodium consumption. Reformulating foods to reduce sodium content is an important intervention that at a population level will save lives. Managing hypertension well. I haven't talked very much about healthcare strategies, clinical strategies, because prevention will get you more health benefits than treatment will. But treatment is, of course, important. Particularly important for hypertension, which kills 10 million people a year. High blood pressure. And the tragedy of high blood pressure is that it's diagnosable and it's treatable. And yet only 1 in 7 people with high blood pressure are sufficiently treated and controlled. Identified, treated, controlled. That's a call to the healthcare system. Mental illness, as I talked about. The strategies for dealing with the global problem of mental illness are well outlined by WHO in their Mental Health Global Action Plan. They range from improving access to treatment, but not specialty treatment. The path to access to treatment for mental illnesses cannot go through specialty care, psychiatrists and things like that. In low and middle income countries, there are single-digit numbers of psychiatrists for millions and millions of people. The pathway to treatment access for mental health in low and middle income countries has to do with task shifting and engaging the entire healthcare sector, not relying on specialty care. We need good policies to protect the rights of people with serious mental illnesses and provide access to services. And we also need to think about prevention. And prevention for mental illnesses, there's a lot of different approaches. One important area is early child development. One of the most important things a country can do to ensure the mental health of their population is to invest in early child development, offsetting the impacts of trauma, supporting parents in raising healthy children. So I'll end there. I've tried to outline a bit about the burden, a bit about the risk factors, and a bit about interventions. And I'll just end again with saying the same thing I said before, which is that we know what works. We know that these strategies that I've outlined, that WHO recommends, are based in science and that will save lives. And it's up to governments to implement them, and it's up to those of us in the non-governmental sector to support that work, to advocate for it. Now I'll turn it over to Katie to talk a little bit about what that looks like.
Great. Thanks, Adam, and good morning, everyone. So my name's Katie Dain. I'm the CEO of the NCD Alliance. So as you've heard already from Adam, the global response to NCDs is clearly at a crossroads. NCDs account for over 7 times as many deaths as infectious diseases. These diseases are hitting low middle-income countries the fastest and the hardest. They are overwhelming economies and health systems alike. And what we know at the global level is that progress against all of the targets and commitments that have been made previously by governments is way off track. So for my organisation, the NCD Alliance, the upcoming UN high-level meeting on NCDs on the 27th of September is really a make or break moment in the response. Let me briefly tell you about the NCD Alliance so you know who we are. We are a global civil society network of 2,000 organisations in 170 countries. Our mission is very much to unite and strengthen the civil society movement to collaborate on advocacy, action and accountability to improve the lives of people living with and at risk of non-communicable diseases worldwide. We've been around for almost 10 years and work very closely with the World Health Organization and the UN, and have been very involved in the previous UN high-level meetings on NCDs, and I'll briefly talk about that now. So in terms of the history of the global response to NCDs, just in a real kind of whistle-stop tour of where we're up to, you'll know that this is going to be the 3rd UN high-level meeting on non-communicable diseases. The first one took place in 2011. It was only the second time that a health issue had been discussed and focused on at the United Nations. And it resulted in a political declaration in 2011 with 22 commitments from governments ranging from the prevention and the treatment side of non-communicable diseases. Following that, the second high-level meeting took place in 2014. And that was when governments committed to 4 time-bound commitments on NCDs, really focusing on all governments having national plans in place, national targets, and really implementing the WHO best buys, which Adam mentioned earlier, which are the cost-effective interventions on NCD prevention and control. An important point here is despite those 2 previous high-level meetings, many of the commitments that were made in 2011 and 2014 have not been met in 2018. Since then, obviously, we've also seen the adoption of the Sustainable Development Goals here at the UN, with the inclusion of NCDs for the first time. NCDs were very much forgotten in the Millennium Development Goals and are very much missing part of the puzzle of global health. And as Adam mentioned, SDG 3.4 focuses on reducing mortality of NCDs by 1/3 by 2030. So that's really the context for this next high-level meeting on the 27th of September. It's a context of a real lack of progress by governments, but it's also, we see it as a real opportunity, and the context is the fact that NCDs have been recognised as a poverty issue and a sustainable development issue. So what are our expectations of this high-level meeting coming up in 2 weeks' time? Who will be there? I'll start with that. So far, we know that 52 heads of government and heads of state are likely to be at the UN high-level meeting on NCDs. That's important because that's actually the highest number of political leaders that have ever come to a UN meeting on NCDs. We had 35 heads of government and heads of state back in 2011. We had 0 in 2014. So raising it back up to the highest political level for us has always been one of our major priorities. And I think the actual regional breakdown of the political leaders expected to be at the high-level meeting is quite interesting, because at the moment we can see that out of those 52, 23 of them are actually from the African region, where the burden is really the greatest. So I think this is really an indication of governments waking up to the challenge and the importance of addressing NCDs. Also, it's significant to mention of who will be there at the high-level meeting is one of the keynote speakers will be the WHO NCD ambassador, Michael Bloomberg, former mayor of New York, who will be delivering a keynote address during the panel. Now let me cover kind of what we're expecting with the political declaration, which is obviously one of the most important parts of this high-level meeting. I think there's two important aspects of the negotiations to date that have really made waves in the media that you may well be aware of. A final political declaration approved by member states has really been held up and has been in limbo for a good couple of weeks, while there has been a standoff between the US government and the South African government on TRIPS flexibilities around the issues of access to essential medicine techs. And this is related to the TB political declaration. You'll be aware that there's a TB high-level meeting that immediately before the NCD high-level meeting. As of late last week, we understand that compromise language has been reached around that paragraph on TRIPS. And our understanding is that currently the G77 countries are reviewing that language. Once that happens, we expect the similar blockage applying to the political declaration on NCDs will be resolved. The second point to mention, which you'll be aware of, is during the negotiations, a fairly contentious issue has been the omission of some of the tried and tested measures that Adam highlighted earlier, particularly around combating NCDs through fiscal policies, such as taxation on sugar-sweetened beverages, tobacco and alcohol. I'm a member of the WHO Independent High-Level Commission on NCDs that put out a report on the 1st of June, which was called Time to Deliver, which got a lot of media pickup. And one of the reasons why it got a lot of media pickup was because the US government very much blocked specific reference around sugar-sweetened beverages tax in that report. And we've seen very much the same dynamics happening during the negotiations on the political declaration. And I'll come back to that in a second. So in terms of what we know about the political declaration and what we see as being positive from the political declaration. Firstly, the political declaration does include strong language around the need for the highest political leadership on NCDs. We all know, as Adam has highlighted through his presentation, that NCDs are not just a health issue. They cut across all different parts of the government, from agriculture, economy, to finance, to education. And in order to really get an effective response to NCDs, we need the highest political level of leadership on the issue. And what we've seen is that the political declaration does call for heads of government and heads of state to be taking a leadership role. Secondly, the positive sides of the political declaration from our perspective is that it includes a strong focus on engagement of civil society. And this is actually much stronger than has been the case in previous political declarations, as well as a very welcome focus on the need to engage and involve people living with NCDs in the response. That's really been very much kind of at the heart of how the HIV/AIDS response has been for many decades. In NCDs, it hasn't been quite the case, but involving people living with NCDs in decision-making, in the way that we're shaping our health systems, in terms of how we're monitoring the response is really key. So that's a very welcome inclusion. Adam mentioned mental health. Mental health has been a bit of an elephant in the room in the NCD agenda. It's been a bit of a missing, a bit of a marginalised part of the agenda. And what's very promising from this political declaration is a really strong focus on mental and neurological health conditions. And in fact, what this high-level meeting really indicates in a way is the World Health Organization's main focus on NCDs over the years has been what we call the 4x4 approach, the 4 major diseases and the 4 risk factors that Adam spoke about. And what we're actually seeing with this high-level meeting is a shift towards the 5x5 approach, with mental health being the 5th disease and air pollution being the 5th risk factor. So for these reasons, we see that as being a very positive piece of the puzzle. In terms of what's the negative sides of the political declaration from our perspective, I have to say there are quite a few from civil society's perspective. Firstly, in terms of what we see as a missed opportunity or the negatives of the political declaration is really a general lack of ambition in the political declaration. It's very, very non-committal, really, really lacking any teeth in the sense of having any targets, time-bound commitments, a lot of fine words in the political declaration, but nothing that really moves things forward in a really dramatic way that we were looking for. Secondly, a negative part of the political declaration from our perspective is a lack of focus on inequities that are driving the NCD epidemic within countries and between, as well as a focus on vulnerable populations. We would have liked to have seen a much stronger focus on the need to address the disproportionate burden of NCDs in marginalised groups such as indigenous populations, disabled people, women and children. Again, a lesson from the HIV/AIDS response has been we need to have a very targeted focus on vulnerable populations if we are to succeed. The third negative point that we see in the political declaration, which circles back to the comment I made earlier, is the omission of language around the best buys, which Adam described. These are the cost-effective interventions that governments have adopted and agreed to at the World Health Assembly in Geneva. They are a set of cost-effective interventions that we know work at the country level. Many of them include things like taxation of tobacco, alcohol, sugar-sweetened beverages, tougher regulations such as restricting advertising of unhealthy products, effective front-of-pack labelling, are just a few examples. Why we think that some of these have been missing in the political declaration is, unsurprisingly, the industries that produce these harmful products, big food, big tobacco, big alcohol, have fought back very hard against them. And they found a few willing countries to really advance their agenda, essentially putting profit over their citizens' health. And those few countries have really weakened the political declaration during the negotiations. And what we've ended up with is very much a kind of lowest common denominator declaration with absolutely zero reference to those WHO best buys that had been agreed to by all governments in Geneva at the World Health Assembly. Number 4, in terms of the negatives, would be around financing for NCDs for us. This has been one of the major Achilles heel in the response over the years. The current levels of investment in NCDs is absolutely pitiful. Less than $1 billion a year of development assistance for health is currently allocated to NCDs, despite the fact that these are really impacting upon developing countries. And that's absolutely peanuts when you compare it to HIV/AIDS, for example, which receives 9 times that amount. And it's really simply inconsequential when you compare it to annual investments in global military expenditure totaling $1.7 trillion. So it's really disappointing from our side to see the political declaration have a very, very weak focus on financing. It's really a kind of copy and paste job of the language used in previous political declarations, and it's really not moving things forward on financing. The 5th point on our negative side of things is the focus on the private sector. And this links back to what I mentioned earlier about, there's an increasing narrative around the commercial determinants of health. Industries that are in the business of producing these unhealthy commodities, really trying to interfere and undermine public health policies that we know work. And in the political declaration, we can see that there's very little new language on what the private sector should be doing. And there's really insufficient focus on the need to safeguard against industry interference. And what we're talking about there is, again, big tobacco, big alcohol, big food. And we would like to have seen much stronger focus on managing conflict of interest within public health policy. The final point I want to highlight is around accountability. We are particularly concerned with the lack of focus on accountability in the political declaration, and one of the clear indicators of this is the fact that the next UN high-level meeting on NCDs has been slated for 2025. That's 7 years from now, a very, very long time to be waiting and allowing governments to really procrastinate in the response. And so 7 years is a very long time, and it's much longer than any other health high-level meeting has been in between. We're used to kind of a 3 or 4 window between the high-level meetings. So that is a kind of an overview of our perspective on the high-level meeting and the political declaration. I just wanted to end on a related note on accountability to give you a heads up on an initiative that we're working on. It's an accountability initiative collaborated between the NCD Alliance, the World Health Organization, the Lancet, and Imperial College London, called NCD Countdown. And it's really an independent accountability initiative which will be monitoring progress on NCDs over the course of many years to come. And it's really an independent accountability initiative. We'll be providing kind of rigorous analysis of why countries are doing well, why countries are doing not so well, and what really the trends are in the NCD response. And just to flag that the first product of NCD Countdown will be coming out on the 20th of September. It will be a paper published in the Lancet, which will reveal which countries are on track to meet SDG 3.4 on mortality, and which are far off track to meeting this deadline. So we'll obviously be sharing that with you all once it is published. And we're expecting many more products to come out of that collaboration. Thank you.